Rewards such as a walk with the principal or 5 more minutes of recess. We might raise funds with walkathons instead of selling cookie dough. We might celebrate birthdays with books instead of cakes. We might require sidewalks within a mile radius of every school so that kids can get to school and they can do it safely. Has anybody ever seen down Broadway, north of the freeway on Broadway, those kids going to school in the street? You've seen that. They're walking to school. There's something called a mom train in that area where one mom starts out, actually she's a grandma, starts out at one end of the line, picks up kids along the way, and they walk to school. And by the way, did I mention the high cost of gas for every parent toting every kid to every school? Businesses. I only have one suggestion for businesses, and that's to stop all marketing to children. All marketing to children, because it's not just Saturday morning messages delivered. It's an insidious bypassing of all adult values toward consumption. Looks like such an easy trade-off. It's such an easy babysitter. And yet every child is learning messages parents don't even hear about. They don't even know. Stop marketing to children in schools. Stop marketing to children on computer games. Stop marketing to children. Just like cigarettes. Isn't that right? You know, I was thinking about the smoking ban in Wichita, where a business that permits children under 18 doesn't have smoking. And initially I thought, we ought to have a total ban. But if we didn't, that's still a good idea, that we need to take care of our children. We need to have a big awareness of what we're doing to them. One of the ways that we can take a wellness message and not take it personally. You know, I focus group my little pen on a couple of people, and one person said, I need my cigarettes, and another person said, I couldn't breastfeed, don't blame me. Rather than giving blame, in fact, to any part of society, we might focus all our efforts in terms of children, because those are the folks, you know, who depend on us now, and we depend on them later. There is an epidemic of childhood obesity going on now, so strongly that our children will die earlier than we will. Their lifespans will be unhealthier. The reason for that is not just schools, it's everything. It's every bank teller that gives a kid candy. It's every parent that takes a kid to school instead of having them walk. There are so many cues for more food and less activity that we really would benefit as a society for really focusing on those issues, rather than heaping blame on ourselves or protecting our own favorite, whatever. I'd like to suggest some other issues that government can do differently. Insurers. The smart money would be that they would fund social marketing campaigns as effective as all the drug money. When marketers want to market, they can do that very effectively. The message to eat less and move more. And also, insurers can reimburse for motivational counseling and prevention, evidence-based prevention. That's why doctors don't do it, because they're run through the mill, is that right, in a conventional practice. It's whipping as many people through the system and to give them the easiest solution, here, take this pill. Because people have to be talked into the facts and the motivations for taking good care of themselves, to circumvent illnesses that may not be on their genetic patterns. Government can retrofit neighborhoods to be activity friendly with sidewalks, benches, bathrooms, and covered areas. The picture on the front, in fact, shows somebody all bundled up and walking, as opposed to two people guiding a walker. It's so much cheaper to take care of yourself. But government can kick in some more of that 4% preventive money on health care. They can, and at every level of government. One model that is in progress with Head Start, Early Head Start here in Wichita, Kansas, is a booklet that teaches parents what signs and symptoms need the emergency room, a visit to the hospital, or their own triage right here, right now. Teaching people how to take care of themselves is money well invested, and they have research to prove it. Here's another sort of off the wall. I hate to be this harbinger, but isn't it a no-brainer that vision cards, what used to be called food stamps, would have a nutrition component? Isn't that smart? With WIC, Women, Infants, and Children, which provides food to just about half of the babies born in Kansas, there is a nutrition component. They can buy only nutritious foods. And the WIC program is documented to save 3 tax dollars for every one it spends. Isn't that where the smart money should go? Into prevention instead of into enabling illness. Every level of government can help. Many businesses can help. It can help us take care of our children and us take care of ourselves. I want to read, we're into reading stuff that came just yesterday. This Consumer Reports on Health. Do we believe Consumer Reports? Takes no advertising, isn't that right? It's pretty credible. In the article entitled Hefty and Healthy, it says exercise can improve health even if the scale doesn't budge. Research on 27, and it names the universities, and more than 27,000 women aged 45 and older. After a decade, the physically active people slashed their risks of heart attack and stroke by as much as 40%. The researchers determined that only about 10% of that decline could be attributed to a reduced body mass index. The rest stem from improvements in markers for inflammation, blood pressure, and LDL, or bad cholesterol. But diet still matters. Study after study has found lower disease rates in people who eat healthfully, with an emphasis on a variety of fruits and vegetables, whole grains, lean protein, and small amounts of unsaturated fat. That diet can lead to improved health costs when it doesn't lead to substantial weight loss. In many ways, we, our family, our government, our businesses and insurers can help us stay well. They can help us and they can help our children. Let's hear it for sidewalks.
Yeah.
Well, we find ourselves in the semi-unprecedented situation of having all of our speakers having gone substantially under the allotted time. They are, in fact, pros. So I guess now we've got a little extra time than we anticipated for questions and your comments.